Good morning, Mr. Nikki. My name is Alyssa. I'm one of the dietitians here. And I just want to come in to ask how you were feeling. How are you doing today?
Good, thank you.
Good. How's your stomach feeling?
It feels good.
No nausea or anything?
No.
Okay, great. Have you experienced any weight loss recently?
No, not much.
How's your appetite been?
I think normal, I would say.
Mm-hmm.
Yeah, I would say normal.
How many meals would you say that you've eaten a day?
I stick to 3 meals a day, but then sometimes when I'm hungry, get like a little snack, which is I probably need to keep an eye on. But yeah,
Mm-hmm.
3 big meals. That's it. Yeah.
Okay, great. Well, do I have your permission to do a quick physical exam on you?
Sure.
Okay.
The dietitian will inspect the skin for color, moisture, texture, temperature, and lesions. Abnormalities may include micronutrient deficiencies. First, the dietitian evaluates the patient's hair quality, looking for changes in texture, thinning, or dullness. Then the dietitian palpates the temples bilaterally for any depression. Severe loss will be hollow. This would indicate a loss in muscle mass. In the orbital region, the dietitian palpates under the eyes and the bony ridge to evaluate fat stores. In an additional scenario, the dietitian will take a closer look at the patient's eyes and the oral cavity of the mouth, tongue, teeth, and gums to evaluate potential micronutrient deficiencies. As the patient sits in an upright position, the dietitian evaluates the clavicle region for any changes or loss of muscle mass. The patient extends their arms straight out, pushing against the hand of the dietitian. She evaluates the muscle groups and the scapula bone and checks for coating of the muscle around the bone and spine area, checking for any depression. Then she guides the patient's arm into a 90-degree angle, being mindful of any IVs or lines, as these can be common in a hospital setting. The dietitian is evaluating the upper arm region for any subcutaneous fat loss. The process involves the RD taking hold of the tricep and gently rolling down her fingers to separate the muscle from fat. If the fingers are touching and only skin is present, this indicates severe loss of subcutaneous fat. As the patient is seated in an upright position, the dietitian examines the thoracic region for subcutaneous fat. She gathers the fat from the bottom of the ribs to the top of the iliac crest. Approximately 1 inch of fat indicates good fat stores. The RD now examines the patient's hands, examining the interosseous muscle while evaluating the patient's nails, nail beds, and perfusion for any potential micronutrient deficiencies by gently pressing down on the nail beds and examining nail quality. Now the RD will examine the lower body, keeping an eye out for any edema, making sure that this is not causing the patient discomfort or pain. The dietitian will examine the anterior thigh, looking for any depression. The RD looks for any muscle loss around the patella region and moves down to examine the posterior calf for muscle definition. This nutrition-focused physical exam is critical in identifying and classifying malnutrition.